much for taking time out of your day to join us for a NeedyMed special topic webinar. We are going to get started momentarily. Before we do, I'd like to ask those of you that have already logged in to help me out, please, with an audio visual check. So if you can hear me clearly and see my screen, which is the first slide of a PowerPoint presentation, please go ahead and send me a message in the questions or chat section of that GoToWebinar control panel to let me know that you can hear me clearly and see my screen. Thank you so much for your help. And we'll also take this opportunity to make sure we can hear our guest panelist, Ashley. So Ashley, give us a shout out so we can make sure we can hear you as well.
Hi there.
Perfect. Thanks everybody for your participation and for letting me know that you can hear both me and Ashley clearly and see my screen, which is the first slide of a PowerPoint presentation. So we're going to go ahead and kick off today's NeedyMed special topic webinar, Lupus 101, presented by NeedyMed's partner, the Lupus Foundation of America. Welcome, everyone. My name is Carla. I'm the Director of Education Initiatives at NeedyMed. And before we kick off today's presentation, I'm going to offer a few tips so you can make the most of it. First of all, if you do have questions, we encourage you to ask them at any time by typing them into the questions section, or for some of you, it may be the chat section of that GoToWebinar control panel. If we don't have the time to answer your specific question, we will follow up with you by email. But we will also, of course, provide our contact information at the end. Also, the heads up that today's webinar, like all NeedyMed's webinars, presentations, and videos, will be recorded and available on the NeedyMed's YouTube channel. And you can also find materials we thought you'd be interested in the handout section of that GoToWebinar control panel. So let's get started with what is NeedyMed. For those of you not familiar with us, we are a national nonprofit founded about 25 years ago. And what you're looking at on the screen now is our mission statement, but simply put, NeedyMed connects people to healthcare savings and educational resources. And we do that free and anonymously through our toll-free helpline, 1-800-503-6897, and our website, needymeds.org. So as you just saw a moment ago on the screen that had the NeedyMeds mission statement, a big part of our mission is educating people. And we do that by letting them know about NeedyMeds and educating them about the resources we offer, but also by educating NeedyMed users about other reputable organizations and diagnosis resources, which is why we are so pleased to have our guest, my friend and colleague Ashley Holden, with us today from the Lupus Foundation of America. So before I transfer the mic and screen to Ashley, I'd like to introduce you to the Lupus Foundation of America as well as Ashley. So the Lupus Foundation of America has made pioneering contributions toward ending the brutal impact of lupus, a misunderstood and unpredictable disease. The Lupus Foundation of America's mission is to improve the quality of life for all people affected by lupus through programs of research, education, support, and advocacy. Their efforts stimulated advances in lupus research that are providing insight into the underlying causes of lupus and its progression, while creating unprecedented opportunities to expand the future knowledge base for lupus. So now let me tell you a little bit about our guest, my friend Ashley Holden. Ashley is a health education manager at the Lupus Foundation of America's National Office. She is a nationally certified health education specialist from the National Commission for Health Education Credentialing. She also has a Bachelor of Science degree in Public and Community Health, a Master of Education in Health Education, and over a decade of experience working in community health and the health insurance industry combined. So with that resume and her experience and expertise about the Lupus Foundation of America. You can see we're so pleased as to take time out of her busy schedule to offer today's presentation, Lupus 101. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Ashley. As she grabs that screen and pulls up her PowerPoint presentation, I'll remind everybody that if you would like to submit questions, again, you can do so by typing them into the questions or the chat section of that GoToWebinar control panel. So without further ado, I'm going to go ahead and pass the mic to Ashley. Thanks for being here, everyone. Enjoy the presentation.
Thank you, Carla, and thank you for the warm welcome. I am so happy to be here today. And as you mentioned, I'll be presenting our Lupus 101, so giving you an overview about lupus and all things lupus. And first, I'll start with a little bit about the Lupus Foundation of America, or the LFA. And so our vision and our mission is really, just to put it simply, our goal is to one day end the impact of lupus and its suffering, while we ensure that we provide the comprehensive support and programs people with lupus need today. And so we really work to meet the diverse needs of all people with lupus. And our commitment has never wavered in over our more than 40 years of service. And today I'm happy to announce that, people with lupus are living longer, healthier lives than ever before. And the Lupus Foundation of America has played a significant role in that achievement. We remain resolved to doing everything we can to help people with lupus navigate the complexities, while rallying every possible resource to end it forever. And so Carla mentioned this a little bit in the beginning, but we really do stand upon 3 pillars. And so those are research, care, and support for people affected by lupus, and advocacy. So we have redefined lupus research to expand our efforts beyond just funding research grants. We engage all stakeholders to identify barriers that stand in the way of progress, and we're setting a course to overcome them. And we do this while we provide caring support for people affected by lupus, by this devastating disease, and by leading advocacy efforts to bring more funding for research and services. So we do, our research is patient-centered and focused on transforming lives. And so we have 3 goals, and they include identifying the causes of lupus, discovering better ways to control symptoms, and ultimately finding pathways to cure lupus. We seek to deliver the most significant impact on people's lives in the shortest time possible. So to do this, we attack lupus from every direction. And so that includes, as you can see here, advocating for sustained funding for lupus research and education programs, funding research that will directly impact people's lives, and bringing together lupus experts from all areas, such as clinicians, researchers, pharmaceutical and biotechnology companies, and government agencies to deliver results. And today, our research efforts are transforming the lives and bringing us closer to our vision of a life free from lupus. So I just really want to mention this, that people with lupus represent the heart and soul of our organization, and people with lupus are the central focus of everything that we do. People with lupus are a constant reminder of our mission's urgency and serve to motivate us to continue this fight. I also want to go over some of our resources before we kind of get into an overview of lupus. And so we have a lot of different resources and programs available. I'm going to talk a little bit about these a little more in depth, but like I said, as you can kind of see here, there's a lot that you can choose from when it comes to programs and services, and these are all free. So the first is the National Resource Center on Lupus, and this is kind of like a living library of resources. It's a one-stop resource for all things lupus. We cover things from treatment to living and coping with a disease. And so it aims to ensure that anyone affected by lupus, including people diagnosed with lupus, caregivers, or even healthcare professionals, all have access to high quality resources that provide emotional support and clear and accurate health information. We know how difficult it can be to find reliable resources out on the internet. So the National Resource Center on Lupus is a really great place to find the most up-to-date lupus information. We also have health education specialists available, and these are specially trained people, health educators, to provide people with lupus or their families or caregivers with non-medical counseling or support, disease education, and helpful resources. The health educators can also help find trustworthy information to answer your questions about lupus and learn how to cope with your lupus. So in order to contact the health educator, we do have a form on our website, and that's lupus.org. And then the specific link for them is lupus.org/health educator. We also have 2 bilingual health educators that speak Spanish. And if you don't need a health educator, I always tell people to tuck that in their back pocket, because you never know when you might encounter someone that thinks they have lupus or has lupus and they might need that resource. We also have the Expert Series, which is our educational podcast series, and we have featured different lupus experts with a focus on helping people live well with their lupus. And so we have these lupus experts offer invaluable insight on a variety of important topics, and they provide knowledge that people need to better manage the disease. We also have a variety of support groups. We have numerous support groups, and so most of them are available virtually at this time. I think some of them are starting to potentially go back to in person, but as I mentioned, most of those are virtual. So if you visit our website, you can find a listing of those support groups. We even have specialty support groups. For instance, we have one that is for youth. We have one for men in lupus. So we do try to pull out some of those more specific populations that may have other kinds of concerns that might need, their own environment. We also have Lupus Connect, and that's our online lupus community where people with lupus and their loved ones can engage with others like them. You can share experiences, discuss practical insights, and this is available 24 hours a day, 7 days a week, 365 days a year. And it's, a great platform to be able to connect with others and ask questions, ask for advice. We also have RAY, which is our Research Accelerated by You, and this is really kind of our way to make progress in lupus research. So you can help advance lupus research right from the comfort of your home. If you participate in RAY, you can share your experiences with lupus to help inform future clinical trials of new lupus treatments and identify the most pressing needs of people with lupus. No one understands lupus better than those actually living with it. So RAY allows you to compare your experiences with others, get updates on new research studies, share medication and health information with your doctor, and help brighten the future of lupus research. We also have Take Charge. This is a 12-week education email series, and it is they're emails from our health educators with tips and resources that can empower someone with lupus to take charge of their health. The series covers important topics such as identifying and tracking symptoms, sticking with a treatment plan, and getting the most out of your doctor's appointments, among others. This is Self, and this was actually featured on the slide that Carla showed a little bit earlier. And this is our new program, and it is an online self-management program, and SELF stands for Strategies to Embrace Living with Lupus Fearlessly. So as I mentioned, this is a free online self-management program. It's basically a virtual coach, and it helps you to build and enhance skills in 4 different pillars of lupus self-management. So those pillars are going to be managing symptoms, managing stress, managing medications, and working with your healthcare team. So no matter how long someone's been living with lupus, SELF includes tips and tools that can help them manage that disease. This is a customized tool based on how you're answering a questionnaire. And there are also different self-care tips based on your readiness to build those new skills and address your specific needs. So it's a really great tool. It has a lot of features in it, such as a symptom tracker, a medication tracker, and a journal to help you record how you're feeling, among many other cool features in there. And then finally, before we take a deep dive into the Lupus 101, just a few different ways you can get involved with the Lupus Foundation of America. So we do have our walks, and a lot of those typically happen in the fall. You can always visit our website to find a walk that might be in your area, or see if there's a virtual walk that you might be able to join. We also do a lot of advocating. We have an advocacy summit that's usually held in the spring, and that's basically a way for us to get the government to commit to funding to advance lupus research. We have Find Ways to Give, which is a lot of times a donation is the easiest way to support a mission, but there are other ways to give, such as car donation or clothing donations in certain areas. You can also start your own fundraiser. You can fundraise in any way you can think of, whether you throw a party or a sporting event and combine it with fundraising. We have people that will host a live stream or even donate a portion of sales from a product. So you can use that to make your mark on lupus. And then raise awareness. Lupus Awareness Month is May, so there's a lot of different events that go along there, but there are also other opportunities to raise lupus awareness throughout the year. And then we also have Race to End Lupus. So whether you're a newbie or experienced athlete, you can combine running, cycling, swimming, or walking with fundraising through a race of your choice or a week-long physical of a virtual 6 challenge. So you can always visit our website to learn more about those. So as we jump in, have you ever heard of lupus? Do you know someone with lupus? Do you yourself have lupus? So really, how familiar are you with this condition? And we're going to give an overview of it because we found through research that lupus is not, a lot of people don't have a lot of awareness of the disease. So lupus is a chronic, long-lasting autoimmune disease that can damage any part of the body, such as the skin, joints, and organs. So we do know that it's long-lasting. There's not a cure. Lupus is also really unique because it is heterogeneous, which means it's different for each person. So you can have 20 people in a room, and there's a good possibility that all 20 people, they might have similar symptoms, but none of them will have the exact same symptoms. And it's also really unpredictable. So we'll talk about this a little bit later, but there can be periods of disease activity or flare, or times where people are in remission. Because of some of the treatment, sometimes people think that lupus might be related to cancer. It is not. Lupus is not contagious, and it is not like or related to HIV or AIDS. So lupus can affect so many different parts of the body. It can cause a lot of different symptoms. Many people with lupus don't have all of these symptoms on the slide here, but the most common signs and symptoms will include extreme fatigue, or fatigue that will not go away regardless of how much rest a person gets. Pain or swelling in the joints, which is often brought on regardless of one's level of activity. About 65% of people with lupus list chronic pain as the most difficult aspect of lupus. Other symptoms include headaches, fever with no known cause, hair loss, swelling, pain in the chest with deep breathing, butterfly rash across the cheeks and nose, sensitivity to UV rays or photosensitivity, abnormal blood clotting, and mouth ulcers. And again, these lupus symptoms may come and go, and they can also change in time, over time. So lupus can affect pretty much any part of the body. So it can affect the brain, it can cause headaches or dizziness, seizures. As I mentioned, there might be some blood disorders, anemia. Kidneys is a very common way that lupus may affect the body. Some people will get what's called lupus nephritis. A lot of people recognize the skin symptoms, but as you can see, there's really a wide range of how lupus can affect the body, and some people may start off with just maybe some skin manifestations, and it may progress over time, or some people, may have a mild case of the disease. It just really ranges by person. And there's actually a couple of different types of lupus. So there's 4 different types, and They're going to be your systemic lupus erythematosus, cutaneous lupus, drug-induced lupus, and neonatal lupus. And we'll talk about these a little bit more in depth. So the first one's going to be systemic lupus, and that is the most common type of lupus, and you'll see it as SLE. And when most people, when they say they have lupus, they're typically referring to systemic lupus. And about 70% of lupus cases are going to be systemic lupus. And so again, this can be mild or severe, and various parts of the body can be affected. And no two people will have identical disease tracks, since it does affect everyone differently. There's also cutaneous lupus, or sometimes you'll hear this as skin lupus. And so about approximately 2/3 of people with lupus will develop some type of skin disease, or cutaneous lupus. And so skin lupus is limited to the skin and can cause many types of rashes and lesions. Skin disease and lupus can cause rashes, sores, or lesions, most of which appear on sun-exposed areas such as the face, ears, neck, arms, and legs. There are 3 subtypes of cutaneous lupus, and they're going to be acute cutaneous lupus, discoid lupus, and subacute cutaneous. Approximately 10% of people with discoid lupus will develop systemic lupus. So it's really important here to note that you can have both systemic and skin lupus, or some people may just have skin manifestations. There's also drug-induced lupus, and this is a lupus-like disease, and it's caused by certain prescription drugs, and it's usually a side effect of long-term use of these medications. There are at least 46 drugs that can cause drug-induced lupus, and a lot of times there are ones being added to that list, especially as we have new medications coming out. The most commonly connected with drug-induced lupus, those medications are going to be hydralazine, which is used to treat high blood pressure. There's also a medication that's used to treat irregular heart rhythms, and there's also a medication used to treat tuberculosis. I am not going to butcher how to pronounce those names, but they are up on the slide. And so drug-induced lupus is more common in men because they are given these drugs more often, but not everyone who takes these drugs will develop the disease. So I just want to point that out. And then, symptoms of drug-induced lupus include joint and muscle pain, arthritis, flu-like symptoms, and inflammation of the heart and lungs. When the medications are stopped, symptoms usually resolve within 6 months. There's also neonatal lupus. So neonatal lupus is not true lupus. It's a rare condition associated with certain antibodies from the mother that can affect the fetus, but it doesn't mean that the mom has lupus. So at birth, the baby may have a skin rash, liver problems, or low blood cell counts, but these symptoms typically disappear completely after 6 months with no lasting effects. Although most have no lasting effects, neonatal lupus can be fatal, and there's also a potential for a heart block with neonatal lupus as well. So let's take a look at what causes lupus. Many scientists believe that lupus develops in response to a combination of factors, both inside and outside the body, including hormones, genetics, and the environment. So most researchers today think that an environmental agent, such as a virus, possibly a chemical, randomly encountered by a genetically susceptible individual, acts to trigger the disease. Researchers have not identified a specific environmental agent as of yet, but the hypothesis remains likely. And so, some of those environmental factors include UV rays, drugs or medication, illness, stress, or injury. So there's quite a list there. Those are the most commonly cited ones. So let's kind of review who gets lupus. The Lupus Foundation of America estimates that 1.5 million Americans and at least 5 million people worldwide have a form of lupus. And our best estimate based on available data on incidence is 16,000 cases of lupus, or new cases are reported each year. While lupus doesn't discriminate, it can affect men, women, and children and people of all ages. We do know that women are more likely to develop lupus. In fact, 90% of people with lupus are women. Lupus is most often diagnosed between the ages of 15 to 44, but it can also be diagnosed during childhood or later in life. And relatives of people with lupus have a 5 to 13% chance of developing lupus. And lupus is the leading cause of death for females 15 to 24 years of age. So we also know that fabulous women are out there working hard to fight lupus and control their health, but unfortunately lupus is so severe in some people that taking control can be impossible. Lupus is 2 to 3 times more prevalent among women of color, and African American lupus patients are more likely to have organ system involvement, more active disease, and lower levels of social support compared to white lupus patients. Children can also be diagnosed with lupus. Between 15 to 20% of lupus is diagnosed in childhood. There is a greater chance of lupus nephritis in childhood lupus. The disease tends to be more aggressive and severe in children and teens than in adults. The symptoms are more intense, and the disease can have long-term effects on a child's growth, quality of life, and even how long they live. The average age of diagnosis of childhood lupus is 12 to 14. Most cases will be diagnosed after 8 years of age. It is very rare before the age of 5, and it is more common in girls. A lot of misinformation exists about lupus, and men with the disease may discover that people are often surprised to learn that they have it because of the incorrect belief that lupus only occurs in women. Men develop the same typical clinical manifestations of lupus as women, yet certain key symptoms may be pronounced in men than women. For example, when men with lupus have kidney involvement, it tends to be more severe. Some studies show that men with lupus commonly experience low blood count, cardiovascular complications, unexplained fever and weight loss, antiphospholipid antibodies, kidney disease, and cirrhosis. So the burden of the disease, we know that lupus has pretty big impact for those affected by the disease. On average, $50,000 is lost annually by each lupus patient in healthcare costs and lost productivity. This estimate may be higher among people with lupus nephritis and more severe active lupus. A Lupus Foundation of America survey found that 55% of lupus patients reported a complete or partial loss of their income because they no longer are able to work full-time due to complications of lupus. 1 in 3 have been temporarily disabled by the disease, and 1 in 4 currently receive disability payments. When it comes to coping with lupus, the survey by the Lupus Foundation of America also found that most patients reported that they are coping well with lupus and that other family members are understanding and supportive. However, they cited that pain, about 65%, lifestyle changes, 61%, and emotional problems associated with lupus, 50%, are the most difficult parts of coping with lupus. So how exactly is lupus diagnosed? So lupus is a disease that is known for being difficult to diagnose because the symptoms are different from person to person. They can come and go, and they mimic the symptoms of many other diseases such as rheumatoid arthritis, blood disorders, fibromyalgia, diabetes, thyroid problems, Lyme disease, and a number of heart, lung, muscle, and bone diseases. It can sometimes take several years for a person to receive an official diagnosis. Many people who have or suspect that they have lupus should see a rheumatologist or a pediatric rheumatologist if it's a child or teen. This type of doctor specializes in diagnosing and treating diseases of the joints and muscles. Since lupus can cause damage to many different parts of the body, other types of doctors or specialists may be involved too. And so those might be a dermatologist, cardiologist, nephrologist, gastroenterologist, pulmonologist, just to name a few. So making a lupus diagnosis is kind of like putting together a puzzle. The doctor will look at several different puzzle pieces: past and present symptoms, medical history, family history, lab tests, and tissue biopsies if needed. If enough of the puzzle pieces fit together, that person might be diagnosed with lupus. So we'll take a look at past and present symptoms and medical history. So the doctor or rheumatologist will likely start with a review of symptoms, like I said, past and present, and medical history. So if the doctor thinks someone might have lupus, they may ask questions about the symptoms, like, what kind of symptoms are you having? How often do you have them? When do they start? Does anything make them better or worse? So they're going to ask a lot about how you're feeling. So it's really important to keep track of those symptoms, even if you've been diagnosed already, to keep track of those symptoms and so that you can discuss them with the doctor. The doctor may also ask if anyone in the person's family has had lupus or another autoimmune disease. And again, an autoimmune disease is a disease where the immune system attacks healthy tissue instead of the invaders like it's supposed to, or it attacks it in addition to them. So that's because people who have family member with an autoimmune disease, they might be more likely to develop lupus. The doctor will likely use different lab tests to figure out if the person has lupus. While there is no single test that can diagnose lupus, lab tests help doctors check for changes in the body, such as inflammation that could be caused by lupus. So there are many different laboratory tests that can be used to detect changes in the body that occur with lupus. So the most common tests are going to be blood and urine tests. And some of those are going to be like a complete blood count, or a CBC, to measure the numbers of red blood cells, white blood cells, and platelets, which are those cells that help blood clot. They'll also likely do antibody tests, which find out if the immune system is attacking healthy tissue. The test you will hear most about is the ANA, or anti-nuclear antibodies test. The ANA test is not a specific test for lupus. It is sensitive and does detect these antibodies in 97% of people with lupus. So the ANA can be positive in people with other illnesses or positive in people with no illness. So for this reason, simply having a positive ANA does not necessarily mean the person has lupus. Doctors trying to diagnose lupus will often look for a number of other antibodies as well. They might do blood clotting time tests to see if the person has a clotting problem. And so the rate at which the blood begins to clot is important. So if it clots too easily, a blood clot could break free and travel through the body. And we know that blood clots can cause damage, such as a stroke. They may also cause something like a miscarriage. And if a blood clot does not clot quick enough, there's a risk for excessive bleeding if injured. There's also complement tests that check for signs of inflammation. Some tests measure levels of protein that are not antibodies, and so that can alert the doctor to inflammation somewhere in the body. And then lupus can attack the kidneys without any warning. I mentioned lupus nephritis earlier, so urine tests are very important. And those tests a lot of times look for cell casts, which are bits of cells that would normally be removed when the blood is filtered through the kidneys. They also look for protein being spilled into the body because the kidneys are not filtering the waste properly. There are some times where someone might need a tissue biopsy. So that's where they're going to remove a small bit of tissue. Usually these are either going to be the skin or the kidney. Those are the most common sites biopsied in someone who may have lupus. The results of the biopsy can show the amount of inflammation and any damage being done to the tissue. Again, further tests on the tissue sample might detect ANA and can determine whether lupus or another factor such as infection or medication is responsible. So again, there's just really a complicated path to diagnosis. There are many challenges to reaching a lupus diagnosis. Lupus is also sometimes known as the great imitator because its symptoms mimic so many other illnesses. And again, those lupus symptoms can come and go. They might be unclear and they change. And then to further complicate it, there is no one single test to diagnose lupus that give doctors a yes or no answer. So really, it can take some time for someone to get a lupus diagnosis, unfortunately. So lupus, as I've mentioned quite a few times, affects people differently. And so usually the best treatment approach is going to be for the person to work with their healthcare team to tailor that treatment plan for their specific symptoms. So it's important to choose the right doctor when it comes to lupus care. And I already mentioned this, a rheumatologist, a doctor that specializes in diseases of the joints and muscles, typically treats people with lupus. Now, if lupus has caused damage to other specific organs, it's likely that other specialists are going to be needed. But most of the time, it's going to be a rheumatologist managing your systemic lupus. So it's important that the person with lupus works with their healthcare team to develop the right treatment plan for them. The treatment plan may depend on the age, symptoms, and general health and lifestyle. It can also depend on other medications that are being taken for other illness or disease. So the goal of any treatment plan are to control symptoms like joint pain and fatigue, reduce inflammation caused by lupus, suppress your overactive immune system, prevent flares and treat them when they occur, and minimize damage to organs. So doctors will use a wide variety of medications ranging in strength from mild to extremely strong to treat lupus, and prescribed medications usually change during a person's lifetime with lupus. Sometimes it can even take months or years before the healthcare team finds just the right combination of medications to keep lupus under control. So these are different commonly used medications. So there are anti-inflammatory medications, and they include non-steroidal anti-inflammatories or NSAIDs. Corticosteroids or steroids like prednisone may also be used. Antimalarials, these are typically going to Plaquenil or hydroxychloroquine are going to be your gold standard. A lot of lupus patients are put on this medication. We also have biologics or monoclonal antibodies, and they include Benlysta and Safnello. Monoclonal antibody is a type of protein made in a laboratory that is developed to find and attach to only one type of substance in the body. And there are many different types of monoclonal antibodies, and they can be used to treat a number of diseases. There are also immunosuppressive medications to help stop the immune system from attacking the body's healthy tissues. And a lot of times these are going to be recommended if the person is having serious lupus symptoms that affect organs like the brain, kidney, heart, or lungs. And then another type of medication that can be used in the treatment of lupus is anticoagulants or blood thinners, and they can help prevent blood clots. We know that sometimes people with antiphospholipid antibodies may need these medications as well. So just a quick timeline. While there are a few different approved medications for the treatment of lupus, only 3 have been specifically developed for the treatment of lupus, and those are going to be Benlysta, Lupkynis, and Safnello. And just to put this in perspective, Benlysta was the first to be approved in 2011, so that was not that long ago. So when it comes to managing lupus, there are some different ways to do that, and I know that we are kind of running short on time, so I'm going to go through these pretty quickly. But I did mention lupus flares. So that's when lupus symptoms worsen and a person feels ill as a result, and that's in comparison to remission, and that's when symptoms improve and the person's feeling better. So a lot of times people with lupus will have these periods of remission and flares. And so it's going to be when people notice a return of those symptoms they experienced before. Flare symptoms can include ongoing fever, not due to an infection, painful swollen joints, increase in fatigue, rashes, sores or ulcers, or general swelling in the legs. And some of the flares just kind of happen. Sometimes there's not really a trigger, but other times there may be triggers. So common triggers include like emotional stress, anything that causes physical stress to the body, so surgery, physical harm, pregnancy, giving birth, infections, or just being sick, exhaustion, exposure to ultraviolet rays, from the sun, or even fluorescent light bulbs, or an injury. It's also important to follow that treatment plan that your doctor has prescribed for you. So taking the medications as prescribed, As I mentioned, keeping a diary to record symptoms, making sure you're talking to the doctor if you have any questions or concerns, and really just paying attention to how you feel. I think everyone, no matter whether you have lupus or not, could probably benefit from eating a healthy diet and being physically active. So really just focusing on healthy proteins, so your lean meats, poultry, and seafood. Trying to get food with calcium, a lot of your vitamins and minerals. Eating lots of fruits and vegetables. And then for lupus patients, we know sometimes physical activity can be difficult, but trying to be as active as you can while gentle on the joint. So you could try walking, swimming. Sometimes people even find relief from yoga. There's also a lot of concerns about managing fatigue and pain. So it's important to get as much sleep as you can, aiming for at least 7 hours. Try to take breaks throughout the day if you're able to. And then for managing pain, talk to your doctor. You can try heat or cold packs, different relaxation techniques, or even healing techniques. Again, talk to your doctor and see if there's, different methods that they might be able to recommend for your situation. Also, stress can definitely trigger symptoms. So, some brief tips here. Trying to plan ahead and decide what is the most important to do. Sometimes we can't accomplish everything in a day, but try to do what's most important and do that task first. So if you don't finish the other things, you won't be quite as stressed. Remember, you can ask for help. Try to make time for fun and relaxing activities. And remember that health comes first, and try not to sweat it if everything does not get done or plans need to be canceled. So a lot of people with lupus are sensitive to UV light. And as I mentioned, this can trigger lupus symptoms. So the UV light can come from sun rays. It can also come from fluorescent bulbs. So trying to make sure you wear sunscreen. If you do have fluorescent lights, they're usually the long ones that you see like in office buildings in the ceiling. They do make shields or covers for those. Trying to wear sun protective clothing and really trying to stay outside or out of direct sun when the sun's at its peak. Some people will say that's about 10 to 2, 11 to 3. I think it just kind of depends, but I'm trying to do those outdoor activities either early in the morning or later in the evening. Lupus does increase the risk for infection, so it's important to try to protect yourself by washing your hands often, avoiding people that might be sick. Um, Sometimes you might want to talk to your doctor about taking antibiotics before procedures. Um, and then vaccines are important, but people with lupus may not be able to get certain vaccines. So it's always important to talk to your doctor or your healthcare team about getting vaccines or even allergy shots before you get them. And so I just want to close out before I turn this back over to Carla with some of our contact information. And so the best way to get updates from us is going to be social media. And again, you can reach out to the health educators or send us an email. And Carla, I will send it back over to you. And I thank you so much for having me.
Ashley, thank you so much for that very thorough explanation about all of the resources, tips, tools, and information the Lupus Foundation of America has to offer, and certainly all the ways people can stay in touch and get involved, as well as that great presentation about what to do when you're diagnosed with lupus. I can tell by the feedback we're getting from the audience, this presentation was greatly appreciated, and people are giving comments that I will mirror as well. Is that, as everybody I'm sure can tell, when Ashley started her presentation, she talked about all the ways to keep in touch with the Lupus Foundation of America, how to get involved, how to advocate for yourself, all of that important information. And one of the things that I am always impressed with the Lupus Foundation of America is not only do they have the most accurate and up to date information, but the website is very easy to navigate, and they are endlessly putting together new programs and resources to connect with not only those living with this diagnosis, but caregivers and loved ones that are trying to help somebody that's living with this diagnosis. I am so excited about Self. I think it's so creative, strategies to embrace living with lupus fearlessly. As Ashley was talking, I was checking it out on the website, which again is lupus.org. And for now, it's right on the home page. And Self is this program described as an online self management program that offers tips and tools to help you better manage your diagnosis of lupus. So, along with all of the other resources Ashley highlighted, please check out Self. I think you'll be really impressed. So, I see a bunch of questions coming in, and we will get to those momentarily. A lot of you remembered, but for those of you that didn't, you can submit questions by typing your question into either the questions or chat section or box of that GoToWebinar control panel. And as we get to those questions, I want to remind everybody that you can rely on NeedyMeds if you are having difficulty affording your medications or other healthcare costs. What you're looking at on the screen is a snapshot of all of the different ways we can help you to save on or afford those healthcare costs. And again, those include but are not limited to medications. So if you'd like to learn more, please visit needymeds.org or reach out to one of our call center counselors. That number is 1 800 503 6897. And I will put that up on the screen again at the very end of the presentation. Also, a reminder to check out other upcoming webinars. Not only do we do our best to populate our calendar of events with diagnosis related topics as well as other healthcare related resources we think our users would be interested in, but we also include overview webinars about NeedyMeds on pretty much a monthly basis, as well as quick webinars. They can be as short as 10 minutes or about up to 20 minutes that do sort of a deep dive into specific healthcare savings resources. So if you'd like to learn more, again, in addition to visiting needymeds.org, reaching out to our call centers, please join us for one of our overview or other NeedyMeds related webinars. So I want to leave up the contact information as promised to the Lupus Foundation of America that you're looking at on your screen now, and you can find my contact information as well as the contact information from NeedyMeds at the bottom. Now, as we said in the beginning, we will do our best to answer all of the questions that are coming through, but again, if we don't get the chance to answer your specific question, we will follow up with you by email as soon as we can, but don't hesitate to reach out to either the Lupus Foundation of America or NeedyMeds at the contact information on the screen. So Ashley, we have a bunch of questions coming in, and thank you again for that great presentation. But one of the ones that came in early on, and a number of other people have asked it, and it's a great opportunity for you to drive this home, which is, what should I do if I suspect I may have lupus?
So that's a great question. And as I mentioned, a lot of times people have difficulty getting that diagnosis quickly. So there are a couple of things that someone can do. And the first, I would say attending this webinar is a great start. It's important to educate yourself about lupus. If you need more information, go and visit our NRCL and learn about the signs and symptoms of lupus. Start communicating with your doctor about any symptoms you're experiencing, any family history of autoimmune disease, and definitely try to keep a symptom journal, even if it's just a note in your phone where you type things like what kind of symptoms you're experiencing and when. It'll be helpful when you start talking to your doctor about this. And then I always recommend seeing a rheumatologist. Even if you're not diagnosed right away, they can at least monitor and keep track of the symptoms you're experiencing, or get a second opinion. But really that rheumatologist can help determine if you have lupus. And like I said, if you currently have a rheumatologist, maybe get a second opinion, maybe see a rheumatology clinic associated with a medical school. Even if your symptoms are not related to lupus, it's important to find a doctor that listens to your concerns and works to determine the cause of those symptoms. I always think it's important to advocate for yourself, even if it's not lupus. Find a doctor that'll keep working to find out what it is.
That's so important. And, one of the things that I want to point out is that I really do appreciate very much about the Lupus Foundation of America is that it's not only information that is helpful to the patient, but it's a ton of information helpful to caregivers or loved ones of somebody that is living with this diagnosis. And the feedback that Ashley just gave regarding the question of what should I do if I suspect I have lupus really can be applicable to everyone with any concern over a diagnosis, because the first step was to educate yourself. One of the next things, or the second step, was to track your symptoms. And the third is to see a doctor or get a second opinion. And I certainly think all of those steps, again, can apply to anyone that is concerned regarding whether or not they do have a specific diagnosis. So thank you so much for that. So another question that came in, Ashley, is, and this is great because it gives the opportunity for you to highlight maybe information for caregivers or loved ones of those living with lupus, which is, do you have advice for someone who has been diagnosed? Excuse me. Do you have advice for someone who has been diagnosed with lupus? And another question right on the tail of that is, do you have advice for someone whose loved one has been diagnosed with lupus?
Right. So those are really important questions. So as far as someone that has, been recently diagnosed with lupus, or maybe you've had lupus for a while, I think it's always important to learn about healthy choices, how you can live well with lupus. So self is so great to keep promoting that, but making sure that you do get your regular medical care, follow-up appointments, and just really kind of taking care of yourself and making sure you take your medication even when you feel good. A lot of times people want to stop taking medication just because they're feeling better. But really just learning about your disease and taking care of yourself, I think is so important. And as far as family members go, I think that it's kind of similar. I think it's important that they familiarize themselves with lupus, encourage their loved ones to educate themselves about lupus, know when you should call the doctor. That's important for both people. Um, and then just really, I think it's important for family members to also understand um, that the person with lupus might have limitations, to maybe offer them help or even ask them how they can help them. Really just have an open discussion and see if there's anything that the person with lupus wishes that they knew about their disease or about how they're feeling. I think that support is just really instrumental.
So important. And I want to take a moment to just pop up. And Ashley, can you see the website right now on your screen?
I can, yes.
Great. Because what I wanted to take a moment to point out is, first of all, right on the front, there's that new self, strategies to embrace living with lupus fearlessly, that we recommended checking out. But the first question that Ashley answered was, what should I do if I suspect I have lupus? And look at this, one of the navigation tabs right there, understanding lupus. Right next to that addresses what Ashley was just talking about, is advice for someone who has a loved one or is caring for someone with lupus, and visit that support and resources tab. And here you can find resources for anyone with lupus, but specifically for caregivers. So I just wanted to give a quick shout out to the website because I think it is so well designed and easy to navigate. So thank you
Well,
for
thank
that.
you, Carla, and thank you for having me today.
Absolutely. And please, to our participants today, check out the Needy Meds calendar of events, because we do regularly ask Ashley to return to host other webinars. So check that out, so you can find out what else you can register for moving forward. We do try to keep the question segment brief. So I want to wrap up, but before we do that, I want to sneak in one last question because I think it's an important one. And Ashley, the question is, where is the best place to go for diagnosis and treatment of lupus?
Right. So treatment centers specializing in lupus care are located in various parts of the United States. Some of these have been designated as centers of excellence by different institutions, for instance, like NIH. The Lupus Foundation of America does not provide like ratings of hospitals or centers or doctors, but we do typically recommend a doctor or a rheumatology clinic that's affiliated with a medical school or university hospital. And oftentimes they'll be kind of involved in lupus research and will be most up to date on the latest advances in diagnosis and treatment of lupus. However, I do recognize that some people may not be close to these types of hospitals. So again, a rheumatologist, if you can find a rheumatologist, if you're several hours from a big city, see if you can find a rheumatologist local. If you have the opportunity, I would definitely recommend seeing if there's a rheumatology or lupus clinic in your area associated with one of those teaching hospitals or universities. But really just, I think seeking care is always the best first step.
Thank you so much, Ashley, for not only the answers to those questions, but the very thorough and extremely informative Lupus 101 presentation. And we're looking forward to you returning. And a big thank you also to those that joined us today for taking time out of their schedule to learn a little bit more about the Lupus Foundation of America and lupus as a diagnosis. We hope to see your names pop up in future webinars. With that, thanks so much, everybody, and have a wonderful rest of the day. Take care.